Breathlessness can be physiological. So, for example, if somebody is doing an exercise or doing exertion to which they're not accustomed to, they can get breathless. The concerning features are when the breathlessness is associated or caused by either some forms of lung disease or heart disease or some other conditions. So, for example, from lungs point of view, we see breathlessness very commonly with any forms of airways problems, for example, asthma or chronic obstructive airways problem like COPD. We also see breathlessness with disease of lungs itself. So, for example, lungs themselves. For example, lung fibrosis or any forms of inflammation in the lungs. We also see breathlessness when there is a problem outside the lungs, for example, fluid around the lungs, a condition which we call pleural effusion, or the muscles controlling the breathing are at fault, for example, diaphragmatic weakness. Or if there is a problem in the lung vessels, for example, clots in the lungs, a condition which can be quite serious actually, which we call pulmonary embolism. Other than respiratory, breathlessness can happen from causes from the heart. For example, if the heart is not functioning properly, what we call heart failure, or due to even other unrelated to lungs and heart causes, for example, quite significant anemia. So breathlessness has a physiological basis, but if when it is not so, people tend to take notice and become concerned. So, for example, if the breathlessness is quite relentless and going on for some time, then it is usually noticed. If it is more than the normal, so we are all used to getting a little bit breathless when we do something heavy, when we carry something heavy, when we do our exercise in the gym, that is something we have come to expect. But when it is unexpected, that's when we tend to take notice. We become more aware of it. So the other condition when we need to be a bit more careful is the timing of the breathlessness. So if it happens quite suddenly, then we need to think there are certain conditions which give rise to sudden onset breathlessness. One of the things we were discussing earlier was clots in the lungs, pulmonary embolism, quite a serious condition, so we need to take notice of it. Equally, if it is persistent and is going on for some time, it is worth getting checked out for that. One of the simple things to measure ourselves is our tolerance to exertion or exercise tolerance. How far can I go before I get breathless? Is it a mile? Is it half a mile? Is it quarter of a mile? That sort of features. And then is it on flat, or am I able to walk uphill without a problem? Do I get breathless then on 3 flights of stairs, 2 flights, or even 1 flight of stairs? Or do I get breathless at any incline at all? These are some of the features that we can notice ourselves, which help to formulate, come to a plan. The next thing to think about ourselves is breathlessness associated with any other features? So for example, do I hear any whistling noise in the chest, a condition which in medical parlance we sometimes call wheezing? Do I have any swelling around my ankles? Do I get any chest pains? Some of these conditions may indicate a problem with the heart, so we need to be aware of that. Do I have something quite unexpected or something new swelling in our calves? So a calf swelling can indicate a clot in the leg veins, which then can transmit to the lung and cause pulmonary embolism that we need to be aware of. And then with the breathlessness, what else is happening? Am I gaining in weight? So if I've suddenly gained a lot of weight, that can cause pressure on the lungs, squash the lungs a little bit, and cause us to become more breathless. On the other hand, if we have lost significant amount of weight, that might indicate something totally different, and we need to be aware of that and raise our concerns appropriately and get these investigated. The next one common feature associated with breathlessness is cough. So have I got a cough? If there is a cough, is it dry or is it productive of mucus? And has the cough been associated with coughing up blood, which is a red flag symptom generally, and we take it quite seriously. The first thing to do will be a thorough clinical assessment, and that means going through the history once again, taking the path as we have discussed generally, but then doing quite a detailed clinical examination. And often these two will give us an inkling about what is the best route to investigate. Am I looking at a respiratory cause, in which case we can look into doing a chest x-ray, a lung function test, which is a spirometry, where we ask people to blow into a machine, and the machine assesses the strengths of the lungs, and if there is any problem with the airways or gas exchange, that can be assessed. Sometimes, occasionally, depending on the findings here, one might need to delve a little bit deeper and require a CT scan of the chest. If, however, our assessment tend to indicate a problem coming from the heart, then one may require an echocardiogram to take it from there. That very much depends on the cause. So whatever we have done so far with our clinical assessment, with our investigations, if we think it is a problem with the airways, often an inhaler of some description will be the first port of call. Exactly what inhaler to use will depend on various findings, etc. But generally speaking, one or the other inhaler may help if there is an airways disease problem. If, however, we find some inflammation in the lungs or any scarring in the lungs, and sometimes we require drugs like steroids or even stronger medications, and it is in those conditions we obviously need more medical input to make a final diagnosis, because these are quite strong medications we are talking about. If our investigations show that this is due to heart problem, for example, fluid around the lungs, then one may require a water tablet, what is called a diuretic. Occasionally, though, we sometimes see breathlessness happening because there is a disconnect between the breathing center in our brain and the lungs, a condition we sometimes call dysfunctional breathing. Dysfunctional breathing can sometimes be associated with a particular cause, in which case, again, we treat the cause. Sometimes there may not be any cause. Sometimes it could be post-viral even. We are seeing that quite a lot with post-COVID. So somebody who has had COVID many months ago now presenting with breathlessness, whereas all their tests are normal, and that's often because of dysfunctional breathing. And there, a breathing retraining exercise can be quite helpful. And we have some excellent physiotherapists who are able to help the patient in that way. So some of the things are relatively straightforward. Lifestyle changes we often request our patients to consider. So if somebody is smoking, then the obvious action would be to stop smoking completely. We know that cigarette smoke can affect the lungs in various ways and can be a very strong cause behind breathlessness. So completely stopping smoking in those cases are highly suggestive and advised. We talked about weight gain. If somebody has gained weight, then that's possibly squashing the lungs and causing breathlessness. In that case, losing weight would be advisable, and often that's all that is required to help the breathlessness. And finally, exercise. And we talked a little bit about exercise with dysfunctional breathing, but general lifestyle, maintaining an active lifestyle, maintaining exercise we often find very useful. In fact, sometimes we treat people with chronic lung disease like COPD with an exercise-based program, and there is a lot of research indicating that such programs are extremely helpful in dealing with the breathlessness.